This is Gina from RN2 Professors with a video in my OB series for you on gestational diabetes review questions. Let's get started. In this video, I'm going to review questions on gestational diabetes. I will show you how to determine what the question is asking and how to answer it. Here's the first question. The nurse is assessing a client who has been diagnosed with gestational diabetes. Which should the nurse monitor closely because of her diagnosis? 1. Edema. 2. Blood pressure and respirations. 3. Urine for glucose and ketones. 4. Hemoglobin and hematocrit. This is an application question. To answer this question, we're going to focus on the assessment phase of the nursing process and the patient's diagnosis of gestational diabetes. So the answer needs to be data from the assessment that is related to her diagnosis of gestational diabetes. Answer 1, edema. We would see edema as a clinical manifestation in a patient with preeclampsia. This is not specific to gestational diabetes. Blood pressure and respirations. Vital signs are assessed with every patient, with every prenatal visit. So again, this isn't specific to gestational diabetes. Urine for glucose and ketones. This is closer to what we're looking for. If a patient has excess levels of insulin in the blood, it will cause glucose and ketones to be in their urine. So this answer is directly related to gestational diabetes and seems like it's going to be the correct answer. However, you always want to go through every answer before you pick your final answer. Hemoglobin and hematocrit. Again, this is not specific to gestational diabetes. You would follow hemoglobin and hematocrit closely if the patient had a diagnosis of anemia. So number 3 is our correct answer. It is the only assessment specifically related to gestational diabetes. Let's take a look at the next question. The nurse is caring for a 35-year-old client with gestational diabetes. Which teaching should be included? Select all that apply. 1. Telling the client the importance of consuming a bedtime snack. 2. Informing the client that she is high risk for type 2 diabetes after the pregnancy. 3. Informing the client that her labor may have to be induced. 4. Teaching the client to drink plenty of fresh fruit drinks to stay hydrated. And 5. Teaching the client how to test her A1C level every day. This is an application question that is asking for client teaching on gestational diabetes. The specific area is not mentioned, so any topic within gestational diabetes could be the answer. When you get a select all that apply question, you should look at each answer individually and evaluate if it fits the question. Number 1, telling the client the importance of consuming a bedtime snack. To prevent hypoglycemia and ketosis during the night, having a snack of a simple carbohydrate and a protein is definitely recommended. This answer fits our question. Number 2, informing the client that she is at high risk of type 2 diabetes after the pregnancy. Clients with gestational diabetes do have a high risk of developing type 2 diabetes later on. This answer also fits our question. Number 3, informing the client that her labor may have to be induced. To answer this question, you have to understand what complications could go with gestational diabetes. If a patient has poor glycemic control, induction of labor could be a possibility due to a large infant size, which is macrosomia, or non-reassuring fetal assessment, Both of these are related to gestational diabetes. This answer, again, fits our question. Number 5, teaching the client how to test her A1C level every day. A1C tests are done by the lab. A client should be taught to take their blood glucose levels daily. This answer also does not fit our question. The correct answers to this question are 1, 2, and 3. All of these fit our question of what kind of teaching should be included for a patient with gestational diabetes. Here's our next question. A gestational diabetic client who requires insulin therapy to control her blood glucose levels telephones the triage nurse complaining of dizziness and headache. Which of the following actions should the nurse take at this time? 1. Have the client proceed to the office to see her physician. 2. Advise the client to drink a glass of juice and then call back. 3. Instruct the client to inject herself with regular insulin. 4. Tell the client to immediately telephone her medical doctor. This question is looking for a priority intervention based on the assessment data given. For you to understand what the correct intervention is, you need to know how to interpret the assessment data that is given. This patient is on insulin. She is complaining of dizziness and headache. These signs and symptoms could either be hypo or hyperglycemia. Since hypoglycemia is an emergency, you need to err on the side of caution. So let's take a look at the answers and see which best fits the priority intervention. Number 1, have the client proceed to the office to see her physician. While the client may need to eventually see the physician, it's not a priority right now. You first need to look for something that you can do for the patient right now. Number 2, advise the client to drink a glass of juice and then call back. If the patient is hypoglycemic, this would definitely be an appropriate intervention. Having the juice could bring their numbers up to get them out of an emergent situation. So this looks like it could possibly be our answer, but again, we want to look at all of the answers before we decide. Number 3, instruct the client to inject herself with regular insulin. Without having a current blood glucose level, this intervention is contraindicated. Number 4, tell the client to immediately telephone her medical doctor. Again, like the first answer, this may need to be done, but is not the priority intervention at this time. So the correct answer is number 2. Advise the client to drink a glass of juice and then call back. Here's our next question. A pregnant client with gestational diabetes has developed polyhydramnios. The client should be taught to report which of the following? 1. Uterine contractions. 2. Reduced urinary output. 3. Marked fatigue. Or 4. Purpura rash. In this question, you need to know how polyhydramnios affects the pregnancy and what signs and symptoms should be reported to the physician. Number 1, uterine contractions. Preterm labor is a risk of polyhydramnios due to your uterus being overextended with fluid. This definitely looks like our answer, but again, we need to check the rest of the answers to be sure. Number 2, reduced urinary output. This is not a risk due to polyhydramnios. The patient would more likely have increased urinary output. So this does not look like our answer. Number 3, marked fatigue. Marked fatigue is not something that would be caused by the patient having polyhydramnios. Number 4, purpura rash. These type of rashes happen in the postpartum period. So again, this answer is not related to polyhydramnios. The answer is number 1. You would be concerned of preterm labor as a risk of polyhydramnios. Let's look at the final question. An 18-year-old client who has reached 16 weeks of gestation was recently diagnosed with pre-gestational diabetes. She attends her centering appointment accompanied by one of her girlfriends. This young woman appears more concerned about how her pregnancy will affect her social life than her recent diagnosis of diabetes. A number of nursing diagnoses are applicable to assist in planning adequate care. What is the most appropriate diagnosis at this time? 1. Risk for injury to the fetus related to birth trauma. 2. Deficient knowledge related to diabetic pregnancy management. 3. Deficient knowledge related to insulin administration. 4. Risk for injury to the mother related to hypoglycemia or hyperglycemia. In this question, you need to focus on the diagnosis portion of the nursing process. To determine the correct answer, you should analyze the assessment data given in the stem of the question. The client's age, gestational weeks, and current concerns are all important in deciding the client diagnosis. Number 1. Risk for injury to the fetus related to birth trauma. There is no supporting evidence at this time to support this diagnosis. Number 2. Deficient knowledge related to diabetic pregnancy management. An understanding of gestational diabetes and the potential effects on the pregnancy is an appropriate answer for this question. The client's lack of knowledge and the adjustments she needs to make to her lifestyle do fit the question. However, we do need to continue to look at the rest of the answers to make sure this is the most correct answer. Number 3, deficient knowledge related to insulin administration. The question does not state the client is on insulin at this time, so this does not fit our question. Number 4, risk for injury to the mother related to hypoglycemia or hyperglycemia. These are important things to know regarding her glycemic controls, but the client does not even understand the lifestyle changes she needs to make at this time. So this needs more understanding before she can participate in a plan of care with hypo and hyperglycemia. Number 2 is the correct answer to this question. I hope this video helped you. If you like it, please subscribe for free and hit the notification bell because we'll be coming out with more weekly videos just like this. Take care and thank you for joining me.